Well, in 2008, I transitioned from being a healthcare industry executive and a practicing physician to being a healthcare strategy consultant, which includes, among other things, being the Fox medical expert. Twice a week, every week since 2008, I do a segment on the morning news on Tuesdays and Wednesdays. It always has 4 questions and 1 graphic and lasts 4.5 minutes. And I've covered stories that range from the smartest, coolest insulin pump to health reform and the SCOTUS decision and why Roberts made the decision that he did, or at least my speculation about that, to the complications that could occur after somebody gets a penis tattoo. Note to self, don't do that. And after each of my segments, I then go offline onto a Facebook chat room and I chat with viewers for about 45 minutes. So you might ask, what crazy, lazy people would ask a question to the TV doctor? And so I thought I'd give you a snapshot of the types of questions that I get. You'll see that they're not so crazy and not so lazy. From Pam, she asked, how does a person get rid of chiggers, which is a mite? Common questions from people when they're too embarrassed to ask someone else. Sometimes I get questions when people are just trying to figure out whether they need professional attention or not, like Lynn when she said that she had stapled her finger and just didn't know whether she really needed to go to the doctor. I get a lot of questions from patients who are trying to figure out if the advice that they got from their doctor was accurate. So Paisley said that she had already had 1 daughter. She had been trying to get pregnant for a year, but couldn't. And her doctor told her it was because she was a little overweight. But she was a little skeptical of that. And what did I think? There's people with chronic illness who want to make sure they're getting the very best care, like Kim, who told me she had an IgA nephropathy. She hadn't had a biopsy. Her renal function wasn't getting any better. Could I give her some advice on questions to ask her doctor to make sure that she was getting the best care? And sometimes people are just desperate for help. So Rob said, no meds, no therapy has ever helped me with depression. What else is there? I've been disabled with this for 18 years. I'm so miserable, have seen numerous doctors. Is there any brain surgery that will help me and my self-hate? I'm desperate. Just to put a little bit of a lighter note on this part of my talk, there's always a funny one. And these were all from last Tuesday, by the way. Brian said, are women only from Venus, or is there some other planet that we don't know about? I think my husband put him up to that question. Well, I answer those questions, and then I share them with friends and talk about them. And then it always confuses me when friends and colleagues that know me well and know what I do say, you know, Archelle, do you ever miss being a doctor? It's not meant with any malintent. I think what they're really trying to say is, well, clearly what you're doing isn't medicine or caring, so don't you miss caring for people? And so that's what this is about. It's about what our current definition of care is. And we have a very rigid definition of care in this country that I'm not sure is present in other countries. But in our country, there's very specific people, places, and things that define care. The people are doctors, nurses, technicians, pharmacists, and other licensed professionals. The places are generally hospitals, clinics, doctors' offices, laboratories, radiology suites, licensed, very regulated facilities. And the things are generally those that are worthy of a CPT code. That is our rigid definition of what qualifies as care in our country. But I'd like to share one more story with you from an interaction I had with a Fox viewer and ask you what you think of this. This was about 3 weeks ago. Chris wrote in, I have cellulitis on my lower forehead with very swollen lymph nodes on the right side of my neck. I started antibiotics 32 hours ago, but my right eye and neck swelling has increased. How long should I wait before going back to the doctor? For those of you who may not be familiar, any infection on the face has a high risk of traveling to the brain because of the interconnectivity of the veins. And so my intuition kicked in. I certainly couldn't diagnose her or treat her, but I could make her realize the urgency of her symptoms. And so I wrote back to her on Facebook in this open chat room, don't pass go, don't collect $200, go back to the clinic or go back to the emergency room because this could become a much more serious infection. And then I gave her a few tips about how to ask her doctor questions about whether she needed IV antibiotics and a CAT scan, because what I was thinking to myself is that she could develop a certain kind of brain abscess. And bless her heart, she kept in touch with me on Facebook while she went to the clinic. So 20 minutes later, she was driving to the clinic and she let me know, like a dutiful patient, even though she wasn't my patient. 3 hours later, she was admitted to the hospital and had gotten a CAT scan, was put on IV antibiotics, and had an abscess. And so I'm going to assume that any clinician in the room would agree with me that the interaction I had with Chris online, on Facebook, while it didn't meet any of the definitions of care, made a meaningful difference in her life and was care. And so I think that we need to remember that there are opportunities that the media brings to us that we can leverage in order to scale, in order to be able to have an impact on greater numbers of people. The resources that I bring to viewers in the Twin Cities is not unique. I'm not the only person that does it. There is a world of health journalists out there. Let's just take an example of the nationally recognized other TV doctors. Everyone from Mehmet Oz to Jennifer Aston, Sanjay Gupta, and of course Nancy Snyderman, who will be here tomorrow. These people probably influence more care in a week than most of us would influence in an entire 30-year career. So think about how powerful it could be if instead of fighting the media, being afraid of the media, avoiding the media, if the healthcare industry could work with the media industry to integrate content with the mind share that they have, wrap it in a package of infotainment, and deliver public health messages and messages about chronic illness. Think about how we could scale. I want to transition from the topic of the media because there are so many other examples that I'd like to share. But I'll transition by saying that one of the reasons that the media is so powerful is that it's on a screen. And screen is where people are, and people are where patients are. People are on screens about 8.5 hours a day. And so how can physicians or nurses or other clinical professionals who are not celebrities use a screen to deliver care? I just want to give you one example. There are probably many. There's a startup company in Minneapolis called Clear.md. They're working in the Twin Cities and across the country with medical practices. They work with doctors to create 1-minute videos of the most common conversations and counseling topics that doctors and other clinical professionals have with their patients. It's that pearl of information that you communicate in the office, you want the patient to remember when they get home, but they just don't. So it's, what are those side effects of statins that I should look out for? How long am I going to be immobile after my knee surgery? Or how do you actually do that colonoscopy prep? Because the patient doesn't remember that in the middle of the night, if they don't have access to that information, what are they going to do? They're going to go to the web and look for the information from someone that they don't know, or they're not going to be compliant at all, or they're going to call the doctor in the middle of the night. So this approach is convenient for the patient. It's available 24/7, it's reliable, and it's consistent with the messages they got in the office. And for the doctor, of course, it reinforces their treatment plan, and it might even prevent a phone call at 2 a.m. As the wife of a gastroenterologist, I am really lobbying for my husband to make a video of what to do when the colonoscopy prep doesn't work, so that people won't call us at 2 in the morning, because we get a few too many of those phone calls. I guess in an ideal world, the people that patients trust most, the doctors and nurses, by surveys, doctors and nurses are who patients trust most for medical diagnosis and advice. And in an ideal world, they would be available 24/7. It's not feasible, it's not practical, and it's never going to happen. And so the social media world has offered an alternative to that. And in fact, 1 in 4 people, because they don't have access to their own care practitioners, actually trust information from people that they don't even know, but people who have experiences similar to themselves. So whether they use the social health networking sites of Patients Like Me, or Autism Speaks, which just does it on a Facebook platform and has 1.1 million users, or the latest social health network to the scene, which is Smart Patients, which has been launched by the former health strategy officer at Google. People are using social health networks to get support that they need, that they're not getting from the healthcare system. And women are the power users of social health networks. So I'm going to give you a specific example of yet another social health network site called Hister Sisters. This is a site that is available for free for women who are going to have a hysterectomy. And the site directs women to sign up based on the date of their hysterectomy so that they can become a community with women who are going through surgery at the very same time, and they can support each other. So the woman who posted this post had her surgery on August 29th, and this is a pretty typical post. She said, "Insomnia attack last night. From what I've been reading, it looks like a few others are having the same issue with this. Hubby is a bit high-strung with me, unable to do anything, and he's really come down hard on the kids, even though they're the ones helping me. I've got to find a way to let him know that this bothers me and makes me feel a bit stressed." So if you read the rest of the posts around it, you'd see that she was reassured that other women were having insomnia issues as well. So it didn't generate a visit or a call to the doctor. And maybe more importantly, the other women on the site gave her permission to be a diva for a little while longer and encouraged her to not get up too fast or do too much. I think it's fair to say that not even the best OBGYN would be able to offer that kind of support. And yet, how many OBGYNs prescribe or recommend this type of site, this one is the biggest one, to their patients so that they can have a good surgical experience and, of course, a good supportive experience? What will it take for doctors to begin prescribing not only the medications and the radiation and the treatment and the rigid definition of CPT-based services that they can for care, but begin thinking more broadly about what people need and make that part of the treatment plan as well? What if the people supporting patients aren't even other people at all? What if they're avatars or humanoids? Let me give you an example. Snow World is a virtual reality therapy game that was designed for burn patients out of the University of Washington, Seattle several years ago. For those of you who may be unfamiliar, besides the incredible trauma that occurs with a major burn, The other major challenge in the treatment is the pain that the burn patients have to endure with the daily bandage changes. Doctors say that it's hard to give enough narcotics safely to give them enough pain so that they can tolerate that wound care. And the patients themselves say that they have sort of a post-traumatic stress disorder, and the pain that they feel during the bandage changes actually reminds them of being back in those burning flames again. And so sometimes they just can't take it. So Snow World was built with the following concept in mind. We know that pain is very much mediated by the brain, and the brain can only have one thought at a time. I know many of you in the audience think you can have 2 thoughts at a time, but you can't. Just try it. The brain can only have one thought at a time. So if you can distract the brain and put someone in a visual 3D icy cold experience that is a game that keeps them active and it distracts their brain to something away from the pain, then maybe they can tolerate it along with other medications that are delivered during that treatment process. The results are remarkable. Burn patients actually report a 35 to 50% decrease in the pain tolerance. This is so impactful that the VA and the military are considering using it for individuals that have these burns during their service. And it sounds incredible, right? Here's what's not incredible about it. This virtual reality game costs $66,000. That's nothing. That's a drop in the bucket. It's only being used in 12 centers worldwide. Why is that? Is price really the barrier here, or is it something else? Is it that it's called a game? Is it that it doesn't fit within our construct of what care is? Let me give you another example, and one that frankly is even more disappointing. Remission is a game that was developed in 2006 by Hope Lab. It's free. You all can go online and download it right now. It's built around the thinking that teens who have cancer have to be motivated to comply with the chemotherapy and the antibiotics and the self-care that is required for them to recover. And that adherence to the treatment plan is very challenging. So in the game Remission, there is a nanobot named Roxy, and she flies through the bloodstream and she uses chemotherapy to shoot at the malignant blood cells. Let me show you a clip about how this works. If we could turn on the clip, please.
Before I had my bone marrow transplant in Seattle, I heard about this amazing game called Remission. My first reaction when I played Remission was just, wow. I was just so amazed. Like, it was familiar, but yet it was so different because I don't usually play video games to learn. I didn't feel like I was learning. I felt like I was just playing a fun game.
Bye, leukemia loser.
It's a morale boost, getting to kill what's keeping you away from your friends, your family.
Remission was so helpful for helping Taylor and I believe a number of other children vent feelings of anger and frustration and despair. And it gave them a way to fight back. Instead of being a victim, it allowed them to be proactive and fight. And one of the biggest things that these hardcore research scientist physicians would say to us when we would say, is there anything else? And they said, they need to know what they're battling and they need to fight. And we think that Remission really helped that.
Remission definitely helped.
So encouraging. A 2008 study published in the journal Pediatrics, a randomized controlled trial in a large number of teens with cancer, showed that their antibiotics compliance improved and their tolerance of chemotherapy improved. And yet I wonder how many oncologists who treat teens are recommending this free game. In fact, I went on to the National Comprehensive Cancer Network site and looked for their guidelines for treating adults and youth with cancer. nowhere in the guidelines. Well, I get it, guidelines take a long time and it's all scientific, but they have a resource list. The Livestrong organization is listed, remission isn't listed. Why is that? I think it's because it's outside of our construct of what's called care. So these are just a few examples of services, of things, of care that can meet currently unmet needs. And I think that with a $2 trillion system that isn't meeting our nation's healthcare needs, we need to begin considering these types of approaches to really deliver care to people that they need and deserve. I know that we have healthcare reform and an accountable care organization movement that seems promising to some, but as I see it, I think that they all remain in a structure of the same ingredients of people, places, and things. That's the same old, same old. It's just being tossed around in a different formula with different financial incentives. What we need is not more of the same. What we need is a system that opens its borders, that respects, acknowledges, integrates with, and collaborates with all of the rest of this very large ecosystem that wants to participate and can contribute to care. And let's face it, while there's a lot of folks out there who are trying to do more, the traditional medical establishment has the keys to the kingdom. The traditional medical establishment gets to decide, at least today, what is defined as care and what is not. And so the question that I ask to you today, because most of you are in that traditional medical establishment, is, are we humble enough to be able to change, to open our borders, and to be inclusive of these new approaches that complement what we are able to do? I hope that the answer is yes, and the appeal that I'd like to make to you today is that that change starts here. Because unless we transform the definition of care, we won't ever have the reform that we desperately need. Thank you so much.
Please stop. You know, I spend a lot of time going over the biographies and the background of all the speakers each year before the conference. And when I was going through the speaker set for this conference, very excited. I didn't think you were even in the top 5 of the people who would refer to penis tattoos on stage. You know, wow.
I'm a storyteller.
Yeah,
What can I knew that would get a few laughs.
There were other storytellers.
That's not even my best story.
Yeah, I'm sure not. I'm sure not. We'll have you back for your best story.
All right.
Let's talk nuts and bolts here for a second, because it's kind of interesting, some of the examples that you pulled up as I mix it with some of the other presentations that we've had over the last day and a half. When you were dealing with your patient client, who had the possible brain abscess, were you a real person to you, or were you kind of an avatar for her in a way, in the way she was relying on you? She was sort of imagining someone who turned out helped her, but in a sense, you weren't that different from an avatar.
Well, I think that that's a fair statement, but do remember that I'm a real person because I've just been on television a few minutes prior to that. And so, particularly since I've been on TV for several years, there's a lot of people who feel they know me, even though I don't know them. I'm in their kitchen with them twice a week while they're having coffee. So I think I really am a real person to them.
But in the sense that you don't really know them, your relationship, and avatar is not a criticism, because people do very powerful things and will take powerful advice from people who they have granted an enormous amount of authority to. I'm wondering if we could begin to mess with the re-engineering of the idea of care if we thought of all of you TV doctors as a really powerful set of front-end avatars for the healthcare system.
I think that that would be an incredibly efficient approach to take. I can't tell you how many times I've run into someone. I'll give you a specific example. I got an email from someone just last week on Facebook that said, "Have you heard of the leaky gut diet?" Well, I look up every question. I make sure that I have the latest evidence-based information on everything. So I look up leaky gut diet because I'm online.
This isn't going to go to colonoscopy
No,
prep.
it really,
Okay,
it really
right,
won't. I
right,
promise.
Good.
And I wrote back and I said, "Did you see that on Dr. Oz?" And of course, she had. She had seen it on Dr. Oz, and Dr. Oz was right. He was more right than me, right? Because he's a bigger celebrity than I am. And so I think that we, need to be cautious that everything a TV doctor says isn't correct, just like everything a practicing physician says isn't correct. But I do think that if we are careful on the construct and are careful on the messages and the content that are delivered, I think it would be an incredibly efficient way to communicate public health messages and chronic illness messages.
A lot of people describe, this is another sort of data set here, and you say that you love data. One of the key problems with the 911 system is that people call with what are not medical emergencies. They call for actual consultation on a set of symptoms that isn't an emergency. And so it seems that there is a hunger out there on the part of either audiences for doctors such as yourself, people who need to call 911 because it's the only option that they have. There's a kind of a hunger out there for a broad sort of customer service voice dealing with healthcare that I'm wondering if you could combine it. It wouldn't be that much different than, when you call customer service to walk you through like a tech problem.
I do think that it has to be credible and it has to be a trusted resource. I don't necessarily think it always has to be a clinical resource, but it has to be trusted and has to be credible. But I think you're absolutely right. There is an incredible hunger and thirst. Those are fabulous words. I get 50 Facebook questions in 45 minutes, one day a week. That reflects to me that there are a lot of people with a lot of questions, and they don't know where to go.
Well, what if the entire front end, and this, again, we're just spitballing here, what if the front end of the healthcare system was some sort of digital portal with available access for everyone, that it wouldn't be a 911 call. You don't call in an emergency. I mean, there is a place that you would call for an emergency, but you could essentially go through a set of symptoms with a kind of customer service sort of expert system, be it a real person, maybe it's an intern, maybe it's a resident who has to spend an hour doing like the sort of intake calls, and that then from that front end, you're referred to everywhere else in the system, the payers, hospitals, actual primary care physicians, that everyone would come to a place like that first. If we grant a TV doctor that much authority, could we grant a system?
Well, I think that that's a great idea, and if somebody develops a business plan around that, I'd like to participate in it. In the meantime, I think that there are an incredible number of resources that do something short of that. There's nothing quite that comprehensive. But there are symptom checkers, there's triage tools online. There are so many of those tools that doctors within the scope of their practice and in their relationship with their patients could recommend. But yet doctors say, no, I've never heard of that before. I've never heard of Hope Lab before. I've never heard of Snow
World.
Snow World.
Right. Well, but there's the scaling problem. There's a huge resource that's out there in terms of people doing peer-to-peer kinds of environments, individual sort of expert systems by disease, people trying to get information out, people like yourself, and yet it's not connected. It's far more likely that you're going to have to search for the connections, and the connections will come to you. What's the solution to that, do you think? You talked at the very beginning about healthcare needs to embrace the media. I'm wondering if it's even bigger than that.
Well, I don't think that one big system is the solution to anything.
Well, you work for Fox. You couldn't possibly think that.
You know, I think you should meet my mom because she's really upset that I'm not with MSNBC.
Really?
Yeah.
Oh my God.
She thinks I'm not a doctor either. So
No, I
that's
think you're a
another-
doctor. I think you're a doctor. Oh, that's so funny. No, that was an economics comment. That wasn't a healthcare comment. Hey, look, if Fox is going to cure me of a brain abscess, I'm going to watch Fox.
All right,
believe me.
perfect. You know, I do think it's interesting to think of really big, grand ideas, and I think that that's a fine idea. I think the reality is that for the foreseeable future, certainly in my career, we're still going to have the individual practice of medicine, you know, with large integrated delivery networks all the way down to the practicing physician. And I think that it would be extremely challenging to have one system. It would be expensive, et cetera. So I think that given that there's so many resources that are available today, you know, this sounds really pedestrian, but I would hope that everyone, every physician, every practitioner in this room would just figure out 5 or 10 resources that could work for them and their patients. Just give them a darn list. Read one less journal article and find 5 good websites so that your patients can have a more seamless integrated experience.
If there was more integration among these information sources, that would, I mean, forget big top-down imposed system, but if there was more cooperation, we'd get a better benefit from the size of the system we already have.
Agreed.
Yes?
Agreed.
All right, Archelle, thanks so much.
Thank you so much.